Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to make a better system for all of us. Before I get started, let me make a comment. Excuse me, a lot of you have sent me stories which are just nightmarish in nature about the problems you've had with Medicare Advantage plans, with regular insurance companies, with prescription drug shortages, watching corporations merge together. And you know, a lot of times the US government doesn't have insight to all of it. However, if I would like you to check yesterday's video or the Healthcare Advocacy newsletter for March 6th, 2024, because there are a lot of actions in there to provide your story to the US government. There were 3 requests for information. In fact, what I will do is I will, in today's description box, I will put a link to the March 6th newsletter, and in there you can find those actions. And you know what? It's an opportunity for you to tell your story, to actually have the government make a better system with tighter regulations for all of us. So let's begin. Today, we're going to talk about staffing levels in mostly in nursing homes, but also in hospitals. Before we do, down below, the Healthcare Advocacy newsletter link is the text for today's talk. And in there, you can, of course, subscribe for free, and all of the studies and analyses and actions that I mentioned, they're all in that newsletter. Okay, so let's get started. Nurses have been fighting for safe staffing levels for years. When nurses are overworked, patient outcomes suffer, nurses become overloaded, and hospitals can become unsafe. Now, there is a bill in Congress called HR 2530, or Senate Bill 1113. It's called the Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2023. It sets those levels appropriately so that hospitals are safer workplaces and more patients can heal and go home. It's worth noting that safe staffing nursing levels are also in HR 3421, the greatly improved Medicare for All Act. I'm just saying. Hold that thought. Now, we have discussed private equity in healthcare over and over again. And one of the ways that extra money is squeezed out of a facility is to reduce staffing levels. We have seen that hospital outcomes suffer, as well as nursing home outcomes suffer when you reduce staff and when private equity takes a hand. In fact, in one working paper actually generated by the government, 18,000 nursing home facilities over a 17-year period were investigated, and they found that private equity ownership was associated with increased excess mortality for residents by 10%, increased prescription of antipsychotic drugs for residents by 50%, decreased hours of frontline nursing staff by 3%, and get this, increased taxpayer spending per resident by 11%. So what did they do? More people die, they're keeping more people doped up by 50%, and they're reducing the number of people taking care of the patients because they're doped up and don't need as much attention, and they're charging more for it. I don't know how they sleep at night. Okay, anyway, another study found that private equity-backed nursing homes had a COVID-19 infection rate and a COVID-19 death rate that were 30 and 40% above the statewide averages. So they're not taking care of the people. Let's be clear, more money is made by short staffing, even if the death rate goes up. Now, on September 1st of 2023, the Centers for Medicare and Medicaid Services, CMS, issued the minimum staffing standards for long-term care facilities and Medicaid institutional payment transparency reporting proposed rule, which seeks to establish comprehensive nurse staffing requirements to hold nursing homes accountable for providing safe and high-quality care for the over 1.2 million residents receiving care in Medicare and Medicaid certified long-term care facilities every day. Now comes a Republican Congresswoman, Michelle Fischbach of Minnesota. She has put forward H.R. 7513, It's a very long title, bear with me. To prohibit the Secretary of Health and Human Services from finalizing a proposed rule regarding minimum staffing for nursing facilities and to establish an advisory panel on the skilled nursing facility workforce. Her bill has passed out of the Ways and Means Committee and is on its way to a floor vote. It has a dozen co-sponsors, all Republicans, and I have a link. They're all listed there. The technique she's using, if you didn't catch it in the title, is don't implement the rule, slow roll it, and we'll study it. You know what? It stinks on ice. I try to make this newsletter apolitical, but it isn't possible today. Republicans allegedly want small government and less regulation, but that means more unnecessary deaths, and we have data to show it. It is true for environmental issues, it's true for healthcare. They are appealing to the "you can't tell me what to do" crowd, but the results are devastating for all of us. They exhibit more care for private equity profits than for the lives of patients. Whenever you vote, I want you to please make sure to vote for people who care about people, not just special interests. Democracy will work so much better if our representatives actually represent our interests. Okay, here's the action. Let's contact our members of Congress, Senate and House, and let's tell them that this bill will increase the death rates in nursing homes, and tell them that we strongly urge them to vote it down if it comes up for a vote. You can also use RESISTBOT by texting SIGN, S-I-G-N, space, PIPRCO to 50409, and here's the email you'll be sending. I'm your constituent, and I want you to know that there's a bill in Congress that I strongly urge you to vote against. It is H.R. 7513. I repeat the name of it. You don't want to. It's a long name. It would prohibit the Centers for Medicare and Medicaid Services from implementing a rule that would set safe staffing levels in nursing homes. A major study found that when staffing levels drop, such as when private equity purchases a nursing home, death rates go up by 10%. There are people dying before their time. That is not fair. And here's a link to the study. I put it in so that their staff members can go read it. It's from the National Bureau of Economic Research. Please do not let this bill pass because it will kill people. While I have your attention, please note that we also need safe staffing levels for nurses. And I would appreciate you passing H.R. 2530 or Senate Bill 1113, the Safe Nursing Staffing Levels Bill. And those same nursing staffing levels are in H.R. 3421, the vastly improved Medicare for All Act. It'd be nice if you would pass that. Anyway, thank you for helping to save lives. That's what I've got for you today. Down below, you can like, share, or subscribe. You can send me comments here in YouTube or at healthcareadvocacy1@gmail.com. And don't forget, if you can help the FTC, the Health and Human Services, and the Department of Justice with their investigations, please do so. Have a good evening.